Well, welcome back, Dr. Vojdani, finally here again. We are so grateful to have you here. For those who don't know, he is a functional and integrative medicine physician who specializes in complex chronic illness, immune dysfunction, mold exposure, hormone imbalance, and personalized root cause medicine. Natasha, obviously, we know is your patient. I also go to your practice. You guys have changed my life. Natasha's health, her husband's health. We are forever grateful for the way you approach medicine and really listen to all of us. And, thank you from all of us. So let's start with Natasha's story and what's going on right now. Natasha, do you want to sort of fill us in on what your symptoms were, what you were feeling, and then we can...
Sure. So I was getting sick all the time. We were recording podcasts with Dr. Vojdani. I'd see him when I'd visit in LA. I'd go with you to visit him. And every time I was sick, and he said something just didn't add up. I was more tired. Also, we had already fixed, a lot of things with inside my body going on with candida. We had been working on and my iron levels and some of my other issues. And that's when he said, we're going to test you for all these viruses, right?
Thank you for the kind words. And thank you guys for having me on again. Yeah, so that's definitely how that story unfolded, Natasha. You're correct. We were working on fungal dysbiosis in the gut with candida. We were working on some iron deficiency issues that you were dealing with as well, which were probably tied to that dysbiosis. And those were, significantly improved, but you were obviously sick all the time. And yes, you have 4 beautiful kids, and that might be a reason that you'd be exposed. But we talked about, you're getting taken down by those viruses, I think, more than we expected for somebody otherwise so healthy and who lives an incredibly clean life. One of the, the real areas of research and expertise that I've, jumped into in the last 5 or 6 years has been, the interplay of what viruses do to our immune system and what the internal terrain of viruses that we are as human beings all entirely exposed to, how that might change and how that might contribute to something like fatigue and getting sick much more often. So we ended up testing you for a bunch of those viruses, and you came back positive for having something called Epstein-Barr Virus reactivation.
What is Epstein-Barr for those who don't know? Explain it to those of us.
Yeah. Epstein-Barr virus is, I would say, notorious as the virus that causes mononucleosis. So that, kissing disease infection that people hear about getting in the end of high school or during college, where, you have a friend who is out for somewhere between 2 to 8 weeks, just lying in bed and just incapacitated. But actually a very small percentage of people who are infected with Epstein-Barr virus actually get mononucleosis. So the first point that's important to discuss is that virtually every adult in this country gets infected with Epstein-Barr virus. And it usually happens during that time frame of high school, college, and the overwhelming majority of us maybe have 0 symptoms whatsoever from that viral infection. The difficult part with that virus is that it has developed an ability to evade our immune system's desire to clear it once we've been infected. And so we get infected, your immune system starts fighting with it, and it finds little hiding places where it can just harbor itself quietly, waiting for some opportunity in the future where it can wake up and start replicating again. And it likes to hide inside the immune system, kind of like a Trojan horse. It likes to hide in the lymph tissue of the neck and the mouth. It also likes the thyroid gland, muscles, and unfortunately, it's something that we call a neutrophic virus, which means it likes to hang out in the central nervous system as well. And the reason it picks all those places is because those are areas that are not very well surveyed by the immune system. So, it can linger undetected for decades, finds a little moment of opportunity, and then starts replicating. And when it's replicating, we call it reactivation of Epstein-Barr virus, and it can stress the immune system, cause fatigue, and unfortunately is linked to the development of many autoimmune diseases as well, like MS and lupus.
I remember that freaking me out, thinking do I have an autoimmune? That was one of my first questions. to you. So how did you test for it? Because I think so many people have messaged saying like, how did you know? Or that they actually know that they have Epstein-Barr virus reactivated, but they didn't know what to do with it. So maybe start with the testing.
Probably one of the more difficult conversations I have with the, really amazing physicians that we have in the community is trying to educate about Epstein-Barr virus reactivation and other viruses that have the potential to do this as well. It's not the only one. Part of the difficulty is that there's a real disconnect between the scientific literature, which is like crystal clear on the concept and how to test for it, versus like the way this is done in community practice. So that's the first thing to acknowledge. Not every physician is up to date on the idea that things like Epstein-Barr virus and a cousin virus called HHV6, human herpes virus type 6, have this ability to have this dual life cycle where they can wake up later. The other real difficulty is the detection methods rely on very, very standard old school laboratory antibody testing, which is done through a technology called ELISA. Quest, LabCorp, all of the kind of standard labs offer these tests, but when they're done in the standard laboratory setting, they're not very high quality. So they have tendencies towards false positives or false negatives. So we send ours out to specialty labs that kind of focus on doing these antibody tests. So the same old school technology, but performing them in a way that there's a lot more precision. And they do that by calibrating the test to known positive and negative samples a lot better than someone like the major lab. So the complex answer to the question is you have to get these tests done with specialty labs. The lab that we use is the lab owned by my dad, Immunosciences in Beverly Hills. He's kind of the immunology OG godfather. So I'm biased, but I think he does it better than anyone else.
Well, that seems to be true. So once you saw that it was reactivated and you recommended this Thymosin Alpha 1, can you explain what that is?
For sure. So first things first, what does Epstein-Barr virus do to certain people, right? I think the most common thing that you'll see is not the triggering of autoimmune disease. That's relatively rare with EBV. It's that like clinically dragging brain fog phenotype that we see very, very often in the community can oftentimes be explained by the Epstein-Barr virus or by the HHV6. So it's not always the scary thing. Oftentimes it's just hey, something is pulling my immune system down and I don't know what it is. And it happens to a lot of people.
Trying to come up with the words was slower for me. That brain fog was there. I'm thinking, is my ADHD worse? And I felt like a lot of those symptoms.
And remember, it's a neutrophic virus. It lives in the brain. So it will definitely cause a lot of inflammation in the brain when it is reactivated, and it can contribute to those cognitive symptoms that you described. So what did we select for treatment for Natasha was peptide therapy. And why? There are no real antiviral medications on the market that have great efficacy against Epstein-Barr virus. Some people use very high doses of Valtrex for a very long period of time, but there's only one study that has ever suggested even possible efficacy there. The other antiviral medications that we have on the market don't work for EBV. There are a lot of very interesting immune therapies that are in the pipeline for EBV because it's a trigger for autoimmune diseases. There's interest in developing these therapies, but as they exist right now, we don't have a great, from the pharmacy, FDA-approved treatment for EBV. So what I have found most successful is trying to re-engage your own immune system in the desire to clear these viruses, because after all, that's what your immune system is designed to do. And we used an immune regulatory peptide called Thymosin Alpha 1. Thymosin Alpha 1 is very likely the most studied peptide in the medical literature on the planet. It is a peptide that gets used actively in many countries in the world: China, Italy, Eastern Europe, South Korea. We don't currently have FDA approval for it. I think that's an entire podcast talking about why, but it's very interesting because there's tons of data on it for a peptide. A lot of it showing efficacy, a lot of it showing mixed signals, but I think very clearly there's a very strong safety profile with it. And as there's been this very big peptide resurgence, and specifically in the new administration removing some of the category denominations on peptides at the end of 24, we've learned that in fact thymosin alpha 1 works really well for something like Epstein-Barr virus reactivation.
So if people are hearing this, they can't necessarily get to your father's lab. They feel like they have this, but there's a lot of peptides offered everywhere. Should they just run out and get this peptide, or what do you recommend the protocol if they can't get to you? They're not in a state where you practice, etc.
Yeah, the really rough part with the peptide world right now is that it's just a complete Wild West. There are gray and black market peptides all over the place, most of them coming from China. In reality, you have no idea if what's on the label of that bottle is really in the bottle. So my suggestion is to find a peptide trained practitioner and to do this under the counsel of a medically trained, practitioner in your area. And there are a growing number of those people. There's no database for them right now. But if you search peptide doc or peptide provider in your city, you're very likely to start finding those things way more than existed a year ago, for sure. And then, as far as not getting access to the, kind of higher end viral labs, getting a Quest test or a LabCorp test is better than nothing in these situations. You just have to make sure that the provider is ordering the right markers. And in particular with Epstein-Barr virus, something called early antigen is the most important marker to check because it's the active replication marker that says this is not just memory to the prior virus. This is actually indicating something is, actively happening at the time you did the blood draw.
Wait, can we go back? Because the peptide thing that you talked about, how so many of them are coming from China, just blows my mind. And that they have there's such a gray black market for them. That's just shocking to me.
Yeah, it's pretty wild. China has a very large chemical manufacturing infrastructure, and obviously things are done in very inexpensive fashion. And quite frankly, the producing of a peptide, which is just a chain of amino acids, is not technically challenging. So, I think they saw how big the peptide market was getting, and they decided to start kind of bringing in very inexpensive versions of these peptides. And, when you're purchasing them online and you really have no idea where these people are sourcing it from, the overwhelming majority is going to come from China.
Wow.
That's not always bad, but, I obviously prefer peptides that are produced in the United States. So, all the peptides that we get are made in California or Arizona and go through the same kind of rigors that a pharmaceutical company would go through. And I think that that's ultimately what you want to ask your provider. Where are you getting them from? What are the kind of standards of quality control that the peptide supplier is going through when you give them to us?
So we got a bunch of questions about Epstein-Barr virus in general. How do you feel about the medical medium protocol for Epstein-Barr virus, if you're familiar with that?
I've probably answered that question 1,000 times in my life, to be honest with you. The very interesting thing about the medical medium is he kind of tends to put everything on Epstein-Barr virus. You guys know me. I'm very scientific and objective, but open-minded. I think that's the nice way I like to describe myself.
You are.
I think the medical medium is finding a nice story to kind of explain what the program is all about. And there are a lot of people who feel better on the program because it involves a lot of very healthy things for you. And I doubt that it has anything to do with Epstein-Barr virus.
Always filling your body with healthy foods is a nice thing, but maybe you need another protocol on top of that.
Test for it, track it, make sure it's going in the right direction. These are things we're very capable of in today's medicine. You don't need to guess. And you certainly don't need to just wonder whether something is working for you.
Can it be treated safely while breastfeeding?
That's a great question. I mean, because we're not using prescription antiviral medications, I think yes. I've had several patients also. Another way that we treat Epstein-Barr virus is with high-dose IV vitamin C therapy, which I have also found effective. Not as effective as TA1, but certainly as effective, more effective than, the options outside of peptides. And safe to do during breastfeeding. It definitely will make the breast milk a little acidic. So I always recommend a post IV dump because baby will not like the flavor of that breast milk immediately afterwards. But, it's just vitamin C. So that's another very harmless, very good for you in multiple ways kind of intervention for EBV. You could definitely do while breastfeeding.
So are peptides safe during breastfeeding in general?
There's no data on what happens to the peptide, if it does cross the, into the breast milk. So I would not recommend it in breastfeeding because you have no idea. I mean, like if your baby's ingesting Thymosin Alpha 1, what is that going to do to their future immune system? You don't really know. They are producing Thymosin Alpha 1 on their own. Peptides are kind of copies of things that we make, and babies probably have far more Thymosin Alpha 1 than anybody on the planet. But what does extra Thymosin Alpha 1 do to a baby's immune system? You have no idea. I want to go over all the things I've seen being triggered by Epstein-Barr virus in the clinic. It's pretty amazing. I mean, once I kind of dove in, and I think, again, like the last 5 years has kind of been like a huge focus of EBV. We've seen, Epstein-Barr virus and other viruses definitely be triggers for things like MS and lupus. It's a huge part of long COVID as well.
Is it a trigger for Sjogren's disease?
It is a trigger on paper for Sjogren's disease as well, trigger for RA. It's a trigger for many, many autoimmune diseases.
And why do you think we're seeing them more in the last 5 years? The Epstein-Barr virus?
Because COVID has kind of brought attention to what viruses can do to the immune system. I mean, Epstein-Barr virus being discussed is nothing new. I think the 1990s were a very kind of hot time of discussing EBV. And then it went silent, I think, until 2020. And then, COVID really brought it back. One of the biggest reasons is that some of the first studies on long COVID showed that maybe 60 to 70% of long COVID patients had Epstein-Barr virus reactivation. And it was one of the kind of big theories on why long COVID happened. Either they had EBV reactivation prior to COVID, or the COVID allowed the EBV to reactivate. We don't know. And then the other huge paper that came out was published in the New England Journal of Medicine in 2023, where they followed, I think, 500,000 military recruits and basically observed that the military recruits that did develop MS had Epstein-Barr virus previously, and basically solidified the idea that EBV was one of the major triggers of the development of MS itself. Remember, these are very, very, very small percentages of people who have EBV reactivation. In our clinic, I would say 30% of the people we test, come back positive for EBV or HHV6. And it's a very small percentage that have autoimmunity triggered by the virus. It's mostly...
What's the second thing? EBV, and then what was the other?
A cousin virus of EBV that's called HHV6. HHV6 causes something called Fifth disease. Do either of you know what that is?
I've never heard of either of these things. Natasha probably knows, but tell me, do I have
Fifth
this?
disease is a really common virus that kids get between the ages of 1 and 3 years old from daycare, where they develop a really high fever and a pink rash on their entire body. And then it goes away. And virtually every kid gets HHV6. So same thing as EBV. We get EBV when we're adolescents or in college. We get HHV6 by the time we're 3, but virtually every kid has had it. And it has that same duality of it hides for a long period of time and then it wakes up. And it acts very, very similar to EBV. They're first cousins of each other.
So is that also something that's treated with peptides?
HHV6 responds a lot better to supplements and IV vitamin C than EBV does. It's a lot easier to treat. I rarely have to go to peptides for HHV6.
Does mycoplasma bacteria play a role in EBV or other chronic conditions?
Great question. So mycoplasma pneumonia is one of those organisms that's discussed in the medical literature as being another trigger for fatigue and autoimmunity. The way I like to think about it is, if the immune system is weakened to the point that it can't keep a lid on viruses, it probably also will not be able to keep a lid on other things like bacteria. So mycoplasma would be one of those things where you see, if you look for both of them, you'll probably find both of them simultaneously. The treatment that I always design is designed to bring the immune system back to life and then to allow that immune system to go in and clear. So whether it's clearing EBV and or mycoplasma, it doesn't really matter. You've got to bring like the resilience back to the immune system to get the clearance to occur.
What about like impacting ferritin levels, or can low ferritin contribute to the reactivation?
So for those of you that are following me on Substack, 2 weeks ago would have seen the very in-depth article I wrote about how important iron status is in immune function. And what prompted me to write that article was I was reading in Nature Medicine an article about the study of iron status in long COVID. And it was found that people who had low iron status or very elevated iron stores had more issues with COVID than people who had normal iron status, which tells you how important your ferritin levels are actually for your immune system's ability to fight things. There's definitely a direct connection between how your body's doing with iron and how you do with viruses.
We also received a lot of questions about kids recovering from Epstein-Barr virus. Are there certain supplements or different approaches that can help kids who have EBV along with low ferritin and even OCD type symptoms?
So the OCD discussion is a little bit separate. So let's kind of put that as part two. So again, this is all about how capable is the immune system to go in and do what it's supposed to with an acute virus and afterwards. And that really comes down to one really simple premise. How distracted is your immune system by your environment going into the infection and afterwards? How much are you exposed to on a regular basis from an environmental chemical perspective, from a food perspective? It really just kind of like hits the idea that your immune system's shape is driven by how you live your life. So rather than talking about supplements in this situation, I'm always saying, what kind of cookware are you using? How are you storing? How are you cooking your food? What's your source of water? And tell me what the content of your food is.
You see why everyone why I love Dr. Vojdani.
I knew, one of the many reasons we love you. I mean, what other doctor is asking these questions, these important questions?
It's true. It's so true. You know, it's like, what is a supplement going to do in comparison to the way you live your life? It's a drop in the bucket versus everything else that you do is going to shape your immune system in such profound ways that the benefit's so different than anything you're going to discuss with a simple supplement. I wish I could just give everybody a supplement and all their problems would go away. But the work is far more difficult and intense than that. And it requires a lot of counseling and coaching.
That's why this week's Substack, if I can give you another plug, was so great on PFAS and the impact of PFAS, if you want to elaborate so I don't botch it.
Yeah, I think, a lot of people talking about PFAS, which is good. We're having conversations about the forever chemicals, I think, regularly. The real difficult part of the forever chemical discussion is that it seems somewhat unavoidable to have some exposure. But, what I really wanted people to understand that it wasn't just about, hey, we're exposed to a chemical and there's this general toxicity that happens. There are direct problems that happen to the immune system from PFAS exposure that you can directly link to the epidemic of inflammation and autoimmunity that's happening in our world.
Wow, so wait, I just want to highlight that again. Can we just double click on that? You're saying that PFAS exposure is leading to a lot of the immune problems that we're having today with all the autoimmune conditions.
Yeah, there's great, interesting studies on the PFAS exposure immune connection, right? There's a higher rate of thyroid autoimmunity for people who are PFAS exposed. Vaccines don't work as well. There's great studies on how the immune system shifts into a pro-inflammatory state for people who are PFAS exposed. We have a lot of info. It's not just like, there's a toxin and toxins are generally bad for me. It is shaping the immune system in this pro-inflammatory direction. And that pro-inflammatory direction is directly responsible for autoimmune disease, cardiometabolic disease, dementia, cancer, anything you name. So it's not like this general thing. It's extremely important. And therefore, even though you're going to have a convo about maybe I can't avoid all exposure, limiting your exposures is extremely important in the ways that you can. And the thing that drives me insane more than anything is nonstick cookware. It drives me absolutely bananas. The marketing games that these companies are playing with nonstick cookware is crazy. They'll use a cousin compound of PFAS and label it PFAS free and say that it's clean or green or healthy. Do not be fooled by any of that. The only nonstick cookware that is healthy would be carbon steel, which is just, it's a pure metal, essentially. It requires way more care than a green pan, but, it's really the only nonstick cookware you could safely use. Get all of that non-cooked stuff out of your life. Like, that's probably the most important thing that you can take away from that article.
We'll come up with the reels or whatever you call it on how to reduce your exposure with PFAS.
And we'll also link all the cookware that Natasha recommends, which is all on her blog, like the cast iron and 360 cookware and all of that. That was part 1 with Dr. Vojdani, and we're just getting started. Next week, we're diving in deeper to peptides. You do not want to miss this, so tune in.
This podcast does not constitute medical advice or recommendation. Please consult your doctor.